Thank you and good morning. I too would like to acknowledge the traditional owners of the land on which we meet today, the Gadigal people of the Eora Nation, and pay my respects to elders past, present and emerging. Thanks to Uncle Ray and the Muggera dancers for the welcome, and the dancer in training was wonderful. His attention was focused on imitating what was done before him, and he was an absolute delight. So I think the traditional dance is in safe hands for the future. To the Honourable Ken Wyatt, Minister for Indigenous Affairs and Aged Care, welcome. And it's good to see you, Ken, because our paths did cross many, many years ago in New South Wales Health. And to our Minister for Health and Medical Research, the Honourable Brad Hazzard, welcome and thank you for your attendance this morning. It's critically important. It's a pleasure to be here and welcome you with our partner, the Aboriginal Health and Medical Research Council. For New South Wales Health has had a partnership for 23 years, and that I think is indicative of the requirement and the need for us to work in partnerships. I'd like to just follow Kerry's cue when she asked, what does resetting mean to us? And from my perspective in New South Wales Health, time to reset is about pausing and reflecting on our successes and our less than spectacular achievements in the area of Aboriginal health. Time to reset is about listening to Aboriginal voices, their aspirations and their desires. And time to reset is about us as government and other service providers changing the way we provide services. They must be culturally safe and they must be appropriate. Our ambitions continue to be high in this area, and I will conclude with a comment from Atul Gawande, which I believe is highly applicable in this situation. Better is possible. It does not take or require genius. It takes diligence. It takes moral clarity. It takes ingenuity. But above all, it takes a willingness to try. And we are here today to try. So welcome and thank you for coming.
Thank you, Elizabeth. Look, I'd just like to acknowledge the Gadigal people of the Eora Nation, elders past and present, fellow Aboriginal staff within the room, within New South Wales Health, some of the AMSs that I've seen come into the room this morning, Minister Wyatt, Minister Hazzard, but also the dancers, and I agree with Elizabeth, the young dancer is someone special, a true dancer in waiting, I think. Look, it's a pleasure to welcome everyone here today to the 5th National Aboriginal and Torres Strait Islander Health Summit. Thank you, Kerry. I've been called a lot of things, but not Scott Morrison before, I don't think. I don't have the checkbook anyway. Thank you, Elizabeth. You're correct. It's been a long and worthwhile partnership with New South Wales Health. We've achieved much over the years, but I think we've still got a long way to go to close the gap or to provide equity in the marketplace for Aboriginal people within health. Time to reset. I think it's a good opportunity for everyone in the room to have a think about what we're doing today. I know that what we've been doing over the last years is going towards helping people and providing better health outcomes. Your presence here today acknowledges that everyone is keen to do something that's different, keen to provide better health outcomes, but more so keen to sit back and learn, listen, and hopefully take away some ideas on what we can do better. But like Elizabeth also said, learn from our mistakes and go forward. I think one of the key things going forward in resetting the agenda is being accountable, making sure that if we are doing something that's not correct, if we are doing something that's not achieving outcomes, sitting back and having a look and reflecting and resetting on what we do. We need to be accountable, but we need to hold those that are also providing services to be held accountable. And I think that today would be a good opportunity to start that process. So, on behalf of the Board of Directors of the AHNMRC and myself, I welcome everyone here today, and I hope that it's a fruitful day and that we learn and we build on partnerships that we've got. But more importantly, we could be here in 10 years' time talking about the same thing, Elizabeth.
It's not you and me.
No, well, it probably won't be you and I, but I think someone will be here talking about the resounding partnership that we've had with New South Wales Health and what we've achieved. So thank you very much.